Welcome back, everyone, to Montgomery County's Engage at Home, brought to you by the county's Caregiver Support Program. Today we have a special guest, Sara, and Sara's going to be sharing information about a wonderful new program that's going to be assisting everyone with advanced care planning. Sara, would you please introduce yourself?
Hi, my name is Sara Hufstader. I'm the lead project coordinator for the Voice Your Choice program. It is a program that motivates people to complete an advanced care plan in advance of a medical emergency.
So welcome, Sara. I understand that you have a terrific presentation planned for us. So let's get on with it. Thank you, Sara.
Thank you, Lily. I really appreciate you having Voice Your Choice here today to talk about the importance of advanced care planning, especially in the environment that we're in today with the COVID-19 outbreak. So I wanted to start off talking about the Voice Your Choice program by talking about our mission. I think it's a really great place to start so people understand better what the Voice Your Choice program is all about. So our mission is pretty straightforward. We motivate people to express and document their healthcare wishes in the event that they cannot speak for themselves. When you look at our vision is much more broad and it involves a lot of different components. Our vision is that people's healthcare wishes will be known and honored when they can't speak for themselves. With that vision, it incorporates a lot of different moving parts. It involves the community, it involves providers, it involves individuals' loved ones, and it works all together to make sure that an individual's wishes are known and that they are honored by their provider and honored by those who matter most to them. So I wanted to introduce elements of the Voice Your Choice program. The Voice Your Choice program promotes advanced care planning through community trainings. And since the COVID-19 outbreak, we've pivoted from doing in-person trainings to remote education. So we offer webinars, and I'll talk about that a little bit later on in the presentation, that we can give to the community, as well as public education about advanced care planning and awareness in the community and with providers about advanced care planning. Our focus audience is all adults 18 years and older, both in Montgomery County and Prince George's County. One of the main points about the Voice Your Choice program is we really encourage what's called a healthcare agent. So selecting a healthcare agent. A healthcare agent is a person who would legally be able to speak for you if you're unable to speak for yourself. So if you had a medical emergency and the doctors were making decisions for you and you couldn't communicate your wishes, a healthcare agent would be there to help you get your voice heard. One of the most exciting elements about the Voice Your Choice program is that we provide access to a free online planning tool. And what's so unique about this is integrated with the Health Information Exchange System in Maryland. So what is this Health Information Exchange System? It's something called CRISP, and it is a way that providers, particularly hospitals and specialists, are able to access information about patients and share information when there is an emergency. If you're traveling through Maryland and you have an accident and you need to be seen in a hospital, that hospital can actually access information at your home hospital and be able to have that information very quickly so they know how best to treat you. The Voice Your Choice program is led by the JSSA, the Jewish Social Service Agency, and it is a program of the Nexus Montgomery Regional Partnership, which is a coalition of the local hospitals that make up Montgomery County's hospital system. So looking at advanced care planning and the COVID-19 pandemic, it's important to do advanced care planning, but even more so during this time. I don't know about you all, but for me, this is a very stressful time. Things are changing. There's a lot of unknowns. Individuals are becoming sick. Some people become very sick. Some people become sick and get better very quickly, but it's very uncertain about what can happen and how it happens. So having a plan in place, if there's a medical emergency, can give you a sense of control, at least over this one small aspect of your life. And it's particularly important for any individual that's considered an at-risk patient. I myself am an at-risk patient. If I have COVID, there's a chance that because of some underlying conditions, I may become more sick than another individual who has COVID-19. And so particularly for those of us who are at high risk, we really want to think about what we would want if we couldn't speak for ourselves, because as you know, sometimes this disease can progress very quickly and you may not have time to make those wishes known. It also gives people an opportunity to express things that they don't want, or perhaps they don't want to be in the hospital. Some individuals have expressed to me that no matter what, they don't want to go to the hospital. They'd rather be home if they're not feeling well. And so this helps. As you know, sometimes hospitals can be overloaded with their patient load. And if doctors know which patients want to have hospitalizations or which patients want to be treated at home, that can allow for more effective utilization and allow those beds to be available for other individuals who would want to go into the hospital to be treated. So I'd like to touch a little bit on the Voice Your Choice resources. We have a number of resources for the community, and I think the biggest piece that's useful to the community in general is our website, and it's very simple. It's voiceyourchoice.org, and when you go to voiceyourchoice.org, and I'll show you in a few moments, you'll get to see that there's a lot of information about advanced care planning, both for the community as well as for providers. And then there's also the opportunity for you to complete your own personalized healthcare plan for free. And that healthcare platform that we talked about, again, will make it more easy for your advanced care plan, your plan that you would put in place if there was a healthcare emergency, to become accessible during an emergency. And also if you were traveling from a different site of care to another site of care. So if you went from a hospital, say, to someplace after the hospital because you weren't ready to go home, you wouldn't have to worry about bringing your advanced care plan with you. That would be taken care of because it would be in this health information exchange system. I'm also going to walk you through a resource list that we have around advanced care planning and COVID-19. We also have advanced care planning webinars, and we're offering at least one webinar, if not 2 webinars every week. And those webinars are also free. And those are step-by-step guides to be walking you through what is advanced care planning, how to choose a healthcare agent, and then how to complete your online advanced care plan. And coming soon, we're going to have a digital advanced care planning how-to guide, so to make that easy for everybody to be able to complete their advanced care plan online. So I'd like to take you now to our website, voiceyourchoice.org. And as you can see, we have many opportunities all over the website to complete your free advanced care plan. So when you come to the website, you can see that we have 3 areas. We have one for the community, one for our community partners, and one for our providers. So I'm going to click on the community link so that you can see the resources that are available to you on the community page. There's a little bit of information about advanced care planning and why it's important. We have the opportunity both here to complete an advanced care plan, as well as down here. There's additional information about the Voice Your Choice program. And you have the opportunity to complete registration for a community training or a community webinar. And you have a link here to learn more about advanced care planning. So when you have a moment, I would strongly urge you to go to the voiceyourchoice.org website, poke around a little bit, get familiar with the resources. As I said earlier, all of our resources are free. So I'm going to take you in a little peek behind the scenes to what that online platform looks like that I keep referring to. And when you go to the online platform, you'll also have the ability not only to complete an advanced care plan online, but if you have an existing paper advanced care plan, you can go ahead and upload that to the platform, and that will make your paper advanced care plan more accessible and more mobile, again, across sites of care. So I'm going to come in as a returning user. And you can see down here, you can create a digital advanced care plan or upload an advanced care plan. And so I'll sign in because again, I've already created an account on the Voice Your Choice platform. And as you look, you see here, you have the opportunity to add your documents. So again, if you have an existing advanced care plan, you can go ahead and upload it here. And this is the dashboard that you would come to if you had an account. I want to point out that throughout the platform, there are videos that you can look at that can give you additional information about how to fill out an online advanced care plan. And I'll also show you throughout that there is a discussion guide, as well as certain words are underlined to give you more information about what those words mean. When we go through our webinar, we focus on what's called the My Decisions tab. Again, the most important thing that we emphasize is that picking a healthcare agent, somebody who can speak for you when you can't speak for yourself, is key. If you make a plan and write down your plan, that is as important. But as we know, things don't always go according to plan. And sometimes you need somebody there to help decipher what would be your wishes if you are unable to speak for yourself. So as you come into the healthcare section, you'll see you have the opportunity to be able to designate a primary healthcare agent, as well as 2 alternates. In case that healthcare agent is on vacation or unable to be reached, there are alternates. You can also decide how much power you want to give each of your healthcare agents and your alternates. As I mentioned, there are underlined words where you can click and you can see that you get additional information. And up in the corner is a video with more information about how to choose a healthcare agent. There's 2 other pages that I'll show you, and then I will leave the rest if you would like to join us for a webinar, or if you would like to start going to the Voice Your Choice website and clicking on the Complete Advanced Care Plan and create your account, and you can look around yourself. Under My Advanced Care Goals, this is an important page. This talks about what's important to you, not just in the context of what kind of healthcare treatment you would want, but what's important to you as an individual, particularly around care. So they have a lot of options here, and what's nice is you also have the option throughout the platform to be able to have a text box if none of these fit exactly with what you're looking for, or if you wanted to add an additional thought. You can also go over here and prioritize what's most important to you. And what's nice about being on a live online platform is that you can make changes anytime that you want. So if down the road, say a few months, you decide, you know what, being with my family is the most important thing to me, and I want to put that ahead of being free from pain. Maybe I don't want medication that's going to make me not as alert and oriented so that I can spend more time with my family. It's that easy to come and log into your account and make those changes. And all those changes will be tracked so that you'll be able to see the changes over time. The other place that we like to focus when we go on our webinars is a section that talks about what you would want for healthcare treatment options. And you'll see a lot of these words are underlined because there's a lot of words that not everybody may be familiar with, such as artificial nutrition and hydration, or some people may not know what a breathing machine is. You can go ahead and click on there and it give you a lot more information. Again, there is a video up in the corner that will help you walk through this. We strongly encourage people to use this particular page to start a conversation with their healthcare providers about what's important to them and what kind of treatments they may want. Your healthcare provider is going to be the best resource for you to answer questions about your particular condition and what may be best for you if you are unable to speak for yourself. So I'm going to go ahead and log off of this and come back to our presentation. But again, I encourage you to either sign up for a free webinar and we'll go into more detail on this platform, or again, come through the Voice Your Choice website and create your own account and look around for yourself. And here is the slide. I always have a slide for both of these just in case I can't access the internet. Sometimes these things happen with technology. So how can the Voice Your Choice program support you? You can go to the website, as I keep mentioning, and you can learn more about advanced care planning and the Voice Your Choice program. You can complete a free online advanced care plan by going to the website. And you're also able to register for a free advanced care planning webinar by contacting Val Walker at the email that you see. And I'll make sure that these resources are available to you post the webinar so that you'll be able to access this information easily. I also want to take a moment and show you the Advanced Care Planning and COVID-19 resource list for additional materials and resources. So again, I'm going to escape out of here. We're going to go back to our website, and we're going to go to the provider section. And under the provider section, we have resources. So you'll see this advanced care planning resources for the COVID-19 epidemic. And this is for both the community as well as for providers. The first part, the yellow section, is primarily for providers. And then you'll see the green section below is for patients in the community. So we have our Voice Your Choice website that you can, these are all direct links, anything that is underlined you can click on and go directly to. We also have resources for an organization called Respecting Choices, which gives a guide for high-risk adults and for healthcare agents of things to think about during this time with the COVID-19 pandemic. There is also the opportunity to access a free 5 Wishes paper advanced care plan, which you could upload onto the platform. And that's a wonderful document. We use that document when individuals don't have access to the internet. And it is a very nice step-by-step process that can walk you through planning for advanced care planning. There's also the Conversation Project, which helps you start conversations with your loved ones, with your doctor, with your healthcare agent. And I strongly encourage you to check out these resources. Usually a lot of these resources are behind a paywall on a website, and so there's a cost associated with them. But right now, because of the epidemic that's going on, there is access for free to these resources. So again, I would strongly encourage you to look at these particular websites. Again, this is available on our website, and we can make this available after the presentation. So popping back to our presentation, I'm going to end on this slide, which has my information, and I'm happy to answer questions, help you if you're having any questions about navigating the website, helping with registration around the webinars, and I would be more than happy to talk to you about advanced care planning. It's a personal passion of mine for professional reasons also, and I always enjoy talking about advanced care planning. So Lily, thank you very much for allowing me to talk about advanced care planning today with you.
Sarah, that was a really incredible presentation, and I continue to be really amazed by how thoughtful you and the team have gone to really make sure that this is user-friendly and something that will inspire them to take seriously and make that action and the decisions required to have an advanced care plan. So you talked about a few dates that are coming up, and I know that those really are going to be important for people. Would you mind stepping us through those?
So we have free webinars coming up throughout the month of May, and we actually update our webinars every month. So there'll be a fresh list, and this will be posted on our website. So looking at our webinars, we have 2 webinars that we make available to the public for free. One is an introduction to advanced care planning and creating an online advanced care plan. And then the second webinar is for people who already have a paper advanced care plan and they just want to make sure that it's portable across sites of care and accessible in an emergency. And so we work with people to show them how to create their account and then upload their paper advanced care plan. And we have, as I mentioned, at least once a week, We have webinars that are available to the community, and we will be creating another one for June, but our next one coming up will be May 19th from 2 to 3 p.m. And then we'll have another one on May 28th from 12 to 1 p.m. Again, you can contact either Val Walker at JSSA or myself, Sara Hufstader at JSSA, and we'll be happy to help you with registration. Thanks.
So Sarah, I've spent a lot of time on the Voice the Choice website, and one of the things that I have been really struck by is how people can really personalize their wishes. That this is something where people can go into incredible details about what they want as part of their advanced care plan. Could you tell us a little bit more about that?
Yes, I think it's really important to highlight the fact that there's a misconception often that falls with advanced care planning, that it's only about things that you don't want. And I like to use a personal story to highlight the fact that it's just as important if you want every single thing as it is if there are things that you don't want. My grandfather recently passed away from COVID-19, and he was in the camp of wanting every single thing that he could have the whole time. And they were actually, the hospital staff was actually taking him off of stuff, but my aunt was such a wonderful advocate, and she had his advanced care plan to show them that he actually wanted to have everything possible done to the very end. And that was his wishes, and she was able to get the hospital to respect that. So I think that showing that compared to my other personal stories, my grandmother, who did not want to have everything done. And it's just as important for her to have those wishes honored as it was for my grandfather to have his wishes honored.
Thank you. That's a really good point. Really being able to be self-determined is so important for all of us. So we are at a time with unexpected free time on our hands. And for many of us, this could be the perfect opportunity to roll up our sleeves and do something that we have either been putting off or, maybe not have thought about before. So tell us a little bit about what people should expect of the amount of time on average that they could be looking at spending in creating their advanced care plan through Voice Your Choice.
So I think that is going to vary, and that's probably not an exact answer that you're looking for, but I can tell you for our webinars, for the complete webinar of completing your online advanced care plan, those are an hour long. And then for the uploads, those are a half-hour long. If somebody was completing it on their own, I think it really is going to depend on how much they're aware of what their wishes are, their values, and thinking about what they would want if they couldn't speak for themselves. When we were holding trainings in person, it was very interesting to watch the room because some people would just roll right through it very, very quickly, and others were more contemplative. So there's no right or wrong answer. It's really whatever you're comfortable with and how you want to have these conversations with your loved ones, with your provider, with your healthcare agent. So unfortunately, I don't have an exact answer for you. I say it varies, but I can let you know that the webinars are an hour and a half hour respectively.
Excellent. And like you said, that each person is going to have their own approach to it, but you have created really low, almost no barriers of entry, that such a short amount of time for people to learn and engage and really take them to the point where they are ready to start doing that introspective work of creating their plan.
Absolutely. And I think one of the things that makes our program so unique and makes us so lucky here in Maryland is the only state in the whole country that has this online platform that connects with the state's health information exchange system, making the advanced care plans more accessible to providers and more mobile across sites of care or within the state. So I think it's really a wonderful opportunity for people to take advantage of this. It's something that's unique, and the state of Maryland had thought really far ahead and was very wise in their thinking about creating this online advanced care planning opportunity. And as I keep mentioning, everything's free. There's no cost to take the webinar or to participate and create your own online advanced care plan, the program takes care of all the costs behind the scenes, and it will always be free for anybody who creates their online advanced care plan through the Voice Your Choice platform.
Absolutely. And this is the second time we've talked about this program, and I see how you have pivoted so well in relation to COVID and are making this so for the general public, they can really utilize this at a time when for many there is uncertainty. So Sarah, we've reached the end of our time together with this interview. Are there any final thoughts that you would like our viewers to take with them?
Yes, I think that oftentimes people get nervous about advanced care planning, or they don't want to think about it. And hopefully through this presentation, we've shown that one, it's really easy. The barriers, as you mentioned, are really low. And now is a good time to do it, not only in the context of the COVID-19 pandemic, but in the context of people having time to be able to go through their advanced care plan, talk to their loved ones, connect with their provider, and get their questions answered. There is no better time than the present to take care of this.
Well said. So thank you once again. It's been so good to have you, and please go well.
Thank you so much. I really appreciate you having me on and allowing me to talk about the Voice Your Choice program.
Thank you. So this is the end of this episode. I want to thank you all for viewing, reminding you that this is Montgomery County's Engage at Home. I'm Lily Fisher, your host with Montgomery County's Caregiver Support Program. Stay calm and be well.